I think at Geisinger, we have special opportunities for our residents to have autonomy and responsibility in a supportive, friendly, interprofessional environment. At our place, we really care about the quality of our learner performance. We help them to learn the basics and things that they need specific expertise in, and we do that in a way that supports their growth while they're here.
The other unique thing about our health system for trainees is that we are also a subspecialty and superspecialty organization. We are the referral center for Central and Northeast Pennsylvania. And so for that reason, the breadth of pathophysiology that we see within our healthcare settings is very robust, and our residents and fellows receive training from all the common illnesses all the way through to the most unique and rare diseases because of the way our health system is organized across Pennsylvania. The other great thing about our organization is we are clinically very busy and we see a lot of patients, and for a learning environment, this is extremely important.
When you decide to be a physician, I have no doubt that part of that vision was one of you providing excellent, safe, and high-quality care to patients. Why should residents and fellows be involved in improving quality and safety of patient care? You are the physicians who spend the most cumulative time with the patients. You're critical because you are at the front lines of care doing the work, and you have a front row seat to see the dysfunction in the system. In my opinion, you are the best suited to help identify areas that could be improved to make patient care safer, delivered with higher quality, and more streamlined.
Professionalism, it means that this is a promise. This is something that we have professed. When we've entered into medicine and when we decided to become healthcare professionals and take care of really vulnerable people, not only our patients, but also ourselves. So the attitudes, the values, the reflections that we're having, all of this is part of professionalism. How professionalism is sort of integrated into the day-to-day here at Geisinger is that it starts from the top, from the leadership. You'll hear from Dr. Gil Land, our CEO and president, that professionalism matters. And a new committee was actually established within the past year to help represent Geisinger and its professionalism. And this committee is known as the Committee of Professionalism and Accountability, also known short as COPA. And it holds everyone who walks through the doors at Geisinger who has any patient contact and any contact with any other healthcare professional accountable for who they're being in the moment and who they are presenting themselves as.
We have a inclusion council in graduate medical education, which is run by residents and fellows. The idea is to create a framework of support and networking, and anybody of any intersection can be part of these affinity groups. We have the Black affinity group, we have the Muslim affinity group, we have the LGBTQ plus group, we have the Women in Medicine group, we have the Hispanic Latino group as well. And the idea is that people with the same mindset can come together, but it's open to everyone. So having this intellectual diversity is great for personal development, faculty development, and actually translates into better patient care.
As the Program Director for Graduate Medical Education's well-being efforts, my role is to work with the department and the institution overall to make sure that residents are being thought of, that their well-being is prioritized and valued, and that the connection is made between their ability to provide quality patient care is predicated on how they're doing personally as humans, to make sure that we all remember these are not robots. I'm available to meet with residents if they have personal or professional concerns, and to work with program directors and leaders to think about how do we create an environment where they can thrive, not just survive residency, but actually, hopefully, thrive.